The current practice of using a tourniquet to gain access to peripheral veins has hardly changed during the last 80 years. That is, until now. Veinplicity is the revolution in venous access. It's a portable, easy-to-use electrical stimulation device that increases local blood volume in the patient's arm and stiffens the vein wall for up to 10 minutes. This improves vein accessibility even on challenging patients. The Veinplicity device should not be used on children under the age of 2, on patients with an implanted electrical device such as a demand pacemaker or defibrillator, or simultaneously with a tourniquet. If necessary, a tourniquet can be used afterwards. For the complete list of contraindications and warnings, always refer to the instructions for use. Before use, disinfect your hands and inspect the device and cable for signs of damage, such as cracks to the casing. Veinplicity shouldn't be used if damaged. Next, you will need to clean and disinfect the device. Start by wiping all surfaces, including the main cable, with a non-abrasive disinfectant wipe. Make sure it is thoroughly wet and allowed to dry completely. After you have cleaned the device and it is dry, repeat this process to ensure the device and cable have been disinfected. Once you've completed these steps, you're ready to go. Start by examining the skin on the palm and bicep. If it is lacerated, don't place an electrode on top of that area. Open the disposable electrode package and apply the white adhesive electrode to the palm of the hand and the blue electrode to the bicep of the same arm. It doesn't matter which direction the electrodes face. After ensuring your device is switched off, plug the main cable into the device, matching the blue socket and plug together. Ensure the plug is fully inserted so you can't see any of its white core. Now plug the disposable electrode cable into the socket of the main cable, matching the white ends together. Make sure the connection is solid.
We've got this device on. When I switch it on, you'll feel a vibration in your arm, maybe a tapping in your arm there.
As you're setting up the device, prepare the patient for the procedure. Explain that they will feel a tingling sensation and vibration in their arm. Switch the device on by moving the dial clockwise from 0 to 1. It will click. The pause interruption light will flick on and off once, showing you there's a signal. The low battery light should not be lit. If it does light up, change the batteries. Slowly apply stimulation by turning the dial clockwise while watching for a physical response. Increase the flow gradually until the patient's tolerability is reached or you observe bicep twitching. Although patients feel a tingling sensation in their forearm, they should not feel pain, even at maximum stimulation. If the sensation is uncomfortable, lower the intensity. The veins will still stiffen, but may take slightly longer to do so. Under normal circumstances, you will deliver stimulation for at least 2 minutes, but no more than 10. The device will automatically shut off after this time. While stimulation is being applied, prepare for the procedure. After approximately 2 minutes, turn the device off and palpate the veins. If the veins need further stimulation, you can turn the device back on. Never attempt venipuncture while delivering stimulation. When you are ready, you can remove the pads and then dispose of them. Patients' veins will remain stiff and palpable for up to 10 minutes. Proceed with cannulation or venipuncture following your standard guidelines or practice. Now that you know how to use the Veinplicity venous access device, let's take a quick look at how to maintain it. The device should be tested by electrical engineers once a year. See your service manual for further information. The device uses 4 AA batteries, which should last for a minimum of 180 minutes of stimulation. To change the batteries, remove the black caps on the back of the device. Take off the back plate using a Phillips screwdriver. Ensure the new batteries face the correct direction. The battery should be disposed of and replaced when the battery indicator is active. Clean and disinfect the device after every use. Wipe the surface using a non-abrasive disinfectant wipe. Make sure all the surfaces are thoroughly wet and then allowed to dry completely. If it is contaminated with dirt or other substances, clean it according to your local infection control policy. Keep the main cable attached to the device to avoid loss. It can be cleaned in the same way as the device, but will need to be replaced approximately every 6 to 9 months. The electrodes are disposable and for single use only. The Veinplicity device is reusable. When it's not in use, store it in a cool, dry place. Veinplicity can be used within a hospital, office or clinic setting. Due to its durable portable nature, it is also ideally suited for use outside, in the field or in vehicles such as ambulances. If you're reporting an adverse event that can be attributed to the Veinplicity device, please contact Regulatory Affairs at Physion.com. If you have any questions about the clinical, technical or operational use of Veinplicity, please contact your local distributor or Physion directly at info@Physion.com.